So I've got too many slides, but I will go through them as best I can. So last year, Laura was here at the ESSTS conference, not here, in Seville, and she told us about a survey that they did with the Dutch patients about what kinds of things they would like to have research done on. And from our meeting last year, we decided, perhaps foolhardily, to perhaps try and do that survey across Europe in different languages. There were 7 questions in total, but we thought, wouldn't it be nice if we could have a sort of research survey across Europe? So I'm going to talk about that very briefly. The Dutch survey was really to hit on certain aims, expanding our knowledge, improving the quality of life in patients. That was really felt to be important, finding out what patients want and need, and the patient's perspective. So the recruitment, if we can call it that, was really through the patients' associations in the different countries, and through the closed Facebook site that we have for the ESSTS patient associations, and also through the meeting here at ESSTS. And so I translated the survey into 13 different languages, badly, and then sent it to the country representative, who then shook their heads and made some edits, and we came upon a final version. And once they were satisfied it wasn't too bad and it was understandable, I asked them to circulate it in their countries. And we liaised about the translation, but then it went live on SurveyMonkey, so I was sort of gathering data from 13 different surveys going on at the one time. The same survey, but in different languages. And I think I'm right in saying this, a bit scary to say this in front of an audience of experts, but I think this was the first time that a survey across Europe had been done from a patient's perspective. Do correct me if I'm wrong. We'll go through the questions quickly, 7 questions that were involved, but the aim was to collect as many views across Europe and see what people were saying and share at this event and beyond, perhaps. So I'm going to try and get through this presentation without offending anybody in any of the countries that were involved or weren't involved. So we translated it into 13 languages, 14 languages, and in speaking with the Swedish patient representative, they were unhappy about the word cannabis being used in the surveys, and because cannabis is illegal in Sweden. So they very nicely sort of withdrew their support, but said we won't send this to our members. So we ended up with 13 versions of the survey. And we had 2,269 responses, which is quite nice, and it was open for around 6 months. Advantages, perhaps this was the first time there was a multi-language survey done in the EU about Tourette Syndrome, I think it is. It was simple, there were only 7 questions, which is perhaps an advantage from the translation point of view, but obviously methodologically that could also be a difficulty. The translations were not done professionally because there was no budget, and there may have been some members that may not have understood the survey. That was my impression about that, because perhaps of the translations. And it was based on the Dutch questions, and really that hadn't been reviewed, so whether these were the best questions to ask, it may not be the case. We may be able to improve on the questions that we used. Interestingly, and again without offending anybody, I must say that, there was obviously variety in the number of people that were completing the survey. And Finland was particularly low, as was, Sweden didn't take part, and also Greece. And I understand that there isn't a Greek patients association, but somebody told me today there might be one, or might be one starting. So this is just a table. I haven't done any fancy statistics or anything, it's just really reporting numbers. But you can see that English was the highest, Dutch, Norwegian, French, and sort of going down to the Greek version with 16 responses. So to save time, I'll go through the questions that were asked, and the first question was, which country are you from? We probably should have had a drop-down box for this rather than just a blank box, because people really varied in their responses. 478 people said they were from the UK. I'm just using the English language as an example. 224 said they were from the UK. 8 said Britain or Great Britain. 172 from England, Wales. So you can see, and I grouped all of these together to say that they were from the UK. And actually, I think I might need to rename the survey, as I thought it would be sort of EU or Europe survey, but there were 22 other countries mentioned 65 times. Obviously, these are English language speakers in different countries, but Australia, India, Tanzania, United States. So really, it was almost like a global survey. I don't know quite how it reached all those people, but I don't think we can call it European so much. Yes, again, just looking at the particular responses, Dutch. So somebody in Japan who speaks Dutch also completed the questionnaire. Somebody in India who speaks Norwegian, and 2 people from the Reunion Island in the Indian Ocean filled out the French version. So I found it quite interesting. Yeah, and it goes on. We're short of time, so I'll go through there. So the general trends were that most people in the 35 to 44 or 55 to 64 age range were completing the questionnaires, generally in these languages. But there were younger groups represented in people who were filling out the German one. There were also some issues, I felt. 38 people out of 65 in Finland didn't answer the age question. So I'm thinking, I wonder why that is. Perhaps, again, it's to do with the translation. Maybe it's something cultural. Maybe people don't like telling their age, or they don't think that it's appropriate. I'm not quite sure. Question 3, what's your relationship to Tourette's? So having Tourette's yourself, I'm a parent, or having a family member. And then there was an instruction, so if you have Tourette's yourself, complete the survey and then come back and do it a second time if you're completing it also for somebody else. And we asked them, if you are a parent, what age is the child? And I put a blank box, which again might have been a mistake, because then you end up with all the dates of births rather than something that's slightly more easy to manage, perhaps, data-wise. And I didn't analyse them, but again, all the data's sitting there, so if somebody's especially keen and wants to do something with it. Question 5, if you had to choose, which would you prefer to see research on, the cause of Tourette syndrome or looking for a treatment? And this is the question that was put to them, and you can see overwhelmingly that people want to see about treatment rather than cause. Question 6, can you prioritise the most important areas to do research on? And they were given genetics, brain, medication, cannabis, behavioural therapy, Botox and DBS, deep brain stimulation, and problems other than tics related to Tourette syndrome. And also we had daily living issues, sorry, I think that jumped off the end of that slide. So you can see overwhelmingly that 1,500 people filled out the most important area of research for them, they felt, were daily living issues, and then problems other than tics. And down the list, we might be surprised to see cannabis and deep brain stimulation, perhaps not, and Botox. And this is just a breakdown of what that looked like. So the comorbidities, perhaps, again, we've often heard, haven't we, that sometimes people are okay with the tics that they have, but it's actually the comorbidities that are more difficult for them to deal with. And then question 7, the last one, in your country, have you heard about, do you know about, and were you offered any of the following treatments? And I've just highlighted cannabis here because you can see it's come up already. But medication, cannabis, behavioural therapy, Botox, DBS, and other, seeking out alternative treatments yourself. That's fairly clear. So a lot more people have heard of the treatments than have received them, so that might make sense. And obviously DBS, a lot of people might have heard of it, but they're not going to have had it themselves because it's not appropriate.
This is just in another format. So, well, those who have heard of the treatment and what percentage offered. And in the other category that was one of those options, I just did one of those sort of word clouds that SurveyMonkey can come up with. I didn't do any sort of complex or really textual analysis, and it's just coming up with some of the words that were picked out from the text that people had written. You can see hypnotherapy, antibiotics, acupuncture, and how big the word is. It depends how often it had appeared in the text. Acupuncture, cannabis, CBD oil, homeopathy. And diet was mentioned 24 times. And just to take diet as an example, people would say things like, my attempted diet changes without success, talking about raw versus, or a whole food diet, somebody talking about probiotic enemas, massage, acupuncture. So these are the kind of things that people have been trying themselves. So I'm sure there's lots of methodological criticisms that could be weighed at the survey, the translation issues, and the cannabis issue, I think, sort of highlights cultural differences that I hadn't perhaps considered beforehand. And whether they generally reflect patients' concerns, were the questions too vague, and maybe we need more scientific method. And there was no control over the dissemination of the surveys in the countries. I just had to sort of put my trust in the person in that country, and I'm sure they all did a sterling job, but they may have gone about it in different ways as well, and that was something that I didn't have control over. So what to do next? Maybe giving the data to each of the countries that was involved, that would be quite good, and then they can perhaps use it, or writing a research paper perhaps. And Laura will be speaking about creating guidelines for researchers after this, but that's something that would be helpful. So very many thanks to all the people that helped translate and circulate the links, and to all of the patients who responded to the surveys. I just wanted to quickly mention, if I've got time, that we're also running some patient surveys in the UK for Tourette's Action, and one's called Why Tourette's Matters, and the other one's looking at physiotherapy. I'd be really interested if anybody's got, if they want to speak to me afterwards about physiotherapy, because it seems like a lot of people or patients don't know that it's even an option for them to perhaps be referred or have access to physiotherapy, which is surprising as it's a movement disorder. But if you have knowledge about this and can enlighten me, but I'm hoping that the results from these two surveys will be really useful in regards to sort of raising awareness and also with funders. And just to really briefly give you an overview of some of the, I just picked out a couple of the questions. But due to your tics, have you ever suffered from pain? And you can see the numbers there, so they're fairly small numbers. The questionnaires are still open, so hopefully there'll be more responses. But I was quite surprised that so many people were experiencing pain. And the length from noticing symptoms to receiving a diagnosis. 1 to 2 years sticking out, but not uncommon for 3 to 6 or 6 years or more. I was quite surprised by that. Again, these numbers might change as more people fill in the questionnaire. Did you receive information from the health professionals who diagnosed you, leaflets or directing them towards us? Looking a bit grim with more people saying no than yes. And that shows we've got some way to go, I guess, in terms of highlighting Tourette's Action and the support associations. An interesting one, do you feel your journey through accessing a diagnosis has affected your mental health? And again, yes, sticking out far more. You can see the numbers there, 142 out of 224, but a sort of resounding yes there. Probably not surprising to the clinicians, but just a quick one. I know that the behavioural therapy sessions are going on today. Have you ever tried behavioural therapy? Quite surprising that more people say no than yes. And then, well, why not? Other, I don't have the information for other, but didn't know about it, I think is interesting. And not provided by the NHS, not covered by insurance. There are no therapists in my area. Obviously I need to uncover what's going on in the other, what are people saying in that other section there. Has TS affected your mental health? Yes, that's what people are telling us in our survey. Stigma, do you feel that any stigma surrounding your TS has affected your mental health? and again, saying yes to that. I really like this quote, I don't know whether you know it, no matter how complicated the research or brilliant the researcher, patients and public always offer unique, invaluable insights. Their advice when designing, implementing and evaluating research invariably makes studies more effective. I'm sure I'm speaking to a converted audience here, but it's something as research manager I think is very true. It makes the studies more effective, more credible and often more cost effective as well. And that was Sally Davis. So thank you very much for listening to me. I'm sorry I've been rattling through it. I hope I did over time. And I think Laura is now going to speak on patient topics as well. So thank you very much for listening.